Look, thanks very much for coming. Just providing you with updates in relation to COVID-19 virus. I can confirm that we've had 4 new cases today, three males and one female, all adults aged in their 20s and 30s. They are all from the metropolitan area and all self-isolating now at home. I can just to report that we still have one COVID-19 patient in hospital at the current point in time. Now, for 3 of these, they've travelled from overseas, one from the UK via Indonesia, which is another way of saying Bali, both inward and outward. So we're not quite sure where or when that person would have contracted the COVID-19 virus, but obviously that is a point of interest, as well as Austria, of all places. We're still waiting for the outcomes of the other individual. One is a healthcare worker, and we are now in the process of just contact tracing all that person's contacts, both in a personal and professional sense. To date, we've had 7,039 negative tests to date, with 817 negative tests throughout regional Western Australia. So at this stage, we're still at a situation where we've got very few cases in Western Australia. Obviously, this comes in the context of places like New South Wales, where overnight they had 57 new cases for 267 cases in total. So provide you with an idea of just the strength of Western Australia's positions at the moment. I just want to take you through a range of messaging today, and that's to do with providing some clarity around social distancing. Obviously, that's something that's being talked about. People are expected to practice it both in their private and professional settings. And from that perspective, what we say is that you should stay 1.5 metres away from people or avoid or minimise contact. Practice good hand washing and cough and sneeze hygiene. Use a tissue or the crook of your arm in relation to that. And in terms of your environmental health, frequently clean surfaces, minimise sharing of objects such as cups and dishes, of course, and ensure proper ventilation. These are the common sense things that we can undertake in order to make sure that we can best avoid coming in contact with the COVID-19 virus. We're also today publishing guidelines in relation to self-isolation. These guidelines provide people with some clear instructions of what's expected in relation to the self-isolation regime. There are essentially 3 levels of self-isolation. Level 1 is for when you're returning home from overseas. Level 2 is for when you have returned from overseas and you become well during the isolation period. And 3 is for when you've returned from overseas, become unwell and test positive for a COVID-19 virus. One of the important things I wanted to point out in relation to this is that if you have COVID, if you're self-isolating and you become unwell and you are tested and you return a negative result, you need to still complete your 14 days of self-isolation. Getting a negative result doesn't mean that you're not incubating the coronavirus bug, and from that's an important issue for people to remember. The other piece of information I just wanted to provide is in relation to our recruitment drive for our work pools for healthcare workers. As of last night, we had 31,700 hits to the website on recruitment, and in addition to that, we've had 995 applications for people to join that work pool. That's an outstanding result, and we're really excited to see Western Australians take up the opportunity to take up the call to arms and take up the opportunity to become part of our important healthcare workforce. We want to make sure that the WA health system is as prepared as it possibly can in relation to the COVID-19 virus. And these work pools will be an important part of strengthening our capacity, not only in the metropolitan area, but making sure that we have work teams that are able to travel to regional areas in the instance that our regional workforce, which is of course not as robust as our metropolitan workforce, need reinforcing. It's terrific to see such a strong outcome.